How much do you know about the most common motor disability in children?
Cerebral palsy affects thousands of kids every year, and today we're going to see what makes it so interesting. Hi, I'm Shaker.
And I'm Sukish, and this is Medicine,
Medicine
Made
made
Simple.
simple.
Thank you for joining us on this episode where we are going to discuss cerebral palsy.
Specifically, we're going to talk about what cerebral palsy actually is, then some signs and symptoms of this condition, then what it's like to live with CP, certain treatments that go along with this condition, some different types of CP, and then finally, what actually causes it.
So first of all, what is cerebral palsy? CP actually isn't a singular disorder, rather it's a group of conditions. These conditions typically relate to movement or processing ability. In fact, palsy is one of the most common motor disabilities in children.
The term cerebral palsy comes from Latin, with the word cerebral meaning brain and palsy meaning weakness or abnormality of muscles. The way CP works is that the brain develops abnormally, or something damages the brain while it grows.
So for example, there's a region of your brain called the cerebral motor cortex, which is kind of a tongue twister, and I'm surprised that I got it on the first try. The word motor means movement, so this area of the brain is responsible for helping you move around.
So, of course, any damage to this area can make it difficult to control your muscle movements. Cerebral palsy can occur if this cortex doesn't develop normally in the fetus, or if there's injury to the brain before, during, or after birth.
So some common problems patients may have are trouble swallowing or eye muscle imbalance, meaning that it's really hard for them to focus their eyes in on certain objects. And according to Dr. Gina Janszewski, a board-certified pediatrician, cerebral palsy affects over 500,000 kids. And since the disorder is made up of groups of conditions, no two children share the same cerebral palsy experience.
So, while two kids may have completely different experiences with CP because of all the groups of conditions, there have been studies showing that around the average survival rate for people diagnosed with cerebral palsy is 87%, which is pretty huge considering how taxing this condition can really be on the lives of patients with cerebral palsy. So even with all of those muscle problems, we see that people with cerebral palsy still have a normal or near normal life expectancy as anyone else, which is again a very great thing considering what it's like with the various signs and symptoms that go along with palsy.
So now you're probably wondering, what are some of the signs and symptoms of cerebral palsy? So there are several different major areas of symptoms for cerebral palsy. One of these major areas is movement and coordination. So those patients suffering from cerebral palsy may have trouble staying balanced, trouble walking, or may not even be able to walk at all. They'll also have trouble with fine motor skills, so things like buttoning a shirt or using scissors.
They also have varying muscle tone, which just means that the amount of tension in their muscles changes a lot. So they might have more tension in their shoulder muscles than they will in their forearm muscles, making it very difficult to move around or do everyday tasks. Another big area is speaking and eating. Oftentimes, people with CP have delayed speech development and trouble speaking in general. They can also find difficulty with chewing or sucking. And another sign is excessive drooling and trouble swallowing.
There are a few development symptoms for people with cerebral palsy as well. One of these is delayed milestones. For example, the baby may not be able to sit up straight or crawl at the same time as other kids are. This delayed growth leads to a smaller size in the kids. There are also many learning difficulty because the brain is damaged, and so some kids with cerebral palsy may even have an intellectual disability.
On top of those disabilities, some conditions can actually occur that affect the brain or other sensory organs. A lot of kids can actually end up having seizures, and they also have problems with hearing, eyesight, and they have abnormal touch or pain sensations. Emotional disorders, behavior problems, or other forms of mental health are also very common.
So while we listed 4 major areas of symptoms that patients with cerebral palsy may suffer through, it's important to understand that each patient is unique and they can either have a single symptom or a combination of symptoms. So it's really important that we understand this fact.
And so, while each patient has completely different symptoms, or they may have even a mix of symptoms, there are certain ways that all patients with cerebral palsy end up living with it.
So one of the first issues that these patients may have is mobility issues. 1 in 3 children with palsy will suffer from quadriplegia, and they also might have issues with communicating because cerebral palsy affects the fine muscles around the mouth and oral cavity, making it hard to speak. In fact, the Cerebral Palsy Alliance cites that 1 in 4 people with palsy cannot talk.
Pain is much more common for people that are diagnosed with palsy. Mostly, this can be the result of skin breakdown or even scoliosis. They can also have trouble swallowing because the muscles in the diaphragm aren't able to contract enough to digest food.
The patients may also have intellectual and learning disabilities. 1 in 2 patients have intellectual disabilities, and 1 in 5 patients have moderate to severe cases of these IDs or LDs. Epilepsy is also very prominent as well. In fact, the Cerebral Palsy Alliance states that 1 in 4 children suffer from epilepsy disorder. And when the children have an intellectual disability and cerebral palsy as a combination, the incidence of epilepsy is almost 50%. There are many more complications that cerebral palsy patients undergo, as we already mentioned, so it's very important that these patients have a great physician-patient relationship so that they can get proper treatment for their symptoms and for their cerebral palsy condition.
And speaking of such treatment, when they talk to their physician, they might recommend certain ways to actually help alleviate the pain. So there are several treatments for cerebral palsy normally that start with a wide range of therapy. And these options include physical therapy, which focuses on muscle exercises, occupational therapy, which improves balance and posture, and even speech therapy.
Besides therapy, medication is also used. And when it comes to medication, the National Institute of Health recommends 2 types of medications. So besides the common drugs like diazepam, others like baclofen, dantrolene sodium, and others are given. Botulinum toxin, which is the drug with the cellular application shown in the image, is also given as well. The purpose of both medications is to relax the muscle tightness within the patient and allow for more muscle motility within the body.
When these muscles become so tight that it's very painful for a patient to walk or move around, orthopedic surgery is usually recommended. If therapy and medication fail, one of the last resorts of treatment for people with palsy is a surgery to cut off the nerves called selective dorsal rhizotomy. The trade-off to this, though, is that it causes limb numbness, sensory loss, and uncomfortable sensations in the areas where no nerves are present.
So to continue with our theme of how no 2 patients are alike, scientists have identified 4 different types of cerebral palsy. The most common one is spastic cerebral palsy, which is where the person has increased muscle tone or stiff muscles. It can affect kids in different places of the body. For example, if the stiffness is only in the legs, they can have trouble walking. This condition is known as diplegia.
If only one side of the body is stiff, for example, the right arm and right leg, then the patient will have more awkward movements, and this is called hemiplegia. And finally, if all 4 of the limbs are affected, as well as the trunk and the face, this is known as spastic quadriplegia, which is the most severe form of spastic CP. These people cannot walk, and they usually have seizures, an intellectual disability, and various other conditions.
So people with ataxic cerebral palsy have trouble with balance and coordination. It's often really hard for them to use their limbs for quick or control-intensive movements like the one I'm doing with my hands. Hypnotic CP is kind of the opposite of spastic, in which you have low muscle tones, which means that the muscles are floppy and not as stiff as they should be.
Finally, dyskinetic cerebral palsy is where people have problems controlling their movements, usually resulting in uncontrollable spasms or jerking movements. This makes it difficult for them to coordinate movements to really accomplish any task.
So overall, these are a few of the most common types of cerebral palsy, but a lot of people can exhibit a mix of these types. For example, a common mix is spastic dyskinetic cerebral palsy.
So speaking along those mixes, when we look at the numbers presented here, we see that spastic cerebral palsy is the most common type of condition. That's the one where it causes a large amount of paralysis, affecting 76.9% of children that are diagnosed with CP. But we also see that ataxic CP is the least common, and this is the one where people have trouble with balance or coordination. And about 15.4% of children with CP have either a rarer type or they have a mix of the previous types, like Sukesh mentioned, simply with the spastic dyskinetic CP.
So now after we've just discussed cerebral palsy all throughout this video, you're probably wondering, what causes cerebral palsy? So there are three main causes of cerebral palsy, and it's attributed to genetics, blunt force trauma to the head, or infections. So normally cerebral palsy is passed down due to a genetic condition. It is the result of gene mutations that cause abnormal brain development, leading to all the several conditions we talked about before.
But of course, genetics isn't the only thing that can cause cerebral palsy. It can also happen after birth if an infant is subjected to blunt force trauma to the head. For example, a fall on the head or child abuse could result in CP. Other brain injuries like an intracranial hemorrhage, which is when there's bleeding within the brain, can cause CP as well.
And another cause of cerebral palsy could be the infections that can affect the womb, such as rubella or herpes. Asphyxia neonatal, which is a lack of oxygen to the infant during delivery, is another common cause of cerebral palsy too.
So today, as a recap, we looked at what cerebral palsy is and we defined it, seeing as that it's not just one condition, but actually a group of conditions that affect the cerebral motor cortex in the brain, which often controls movements, meaning patients with CP have difficulty moving.
We also saw some of the signs and symptoms apart from movement, like fine motor skill difficulty, paralysis, epilepsy, and more.
We then examined what it's like living with cerebral palsy, and that while no two kids share the same experience, many have the same symptoms or problems, like trouble eating or breathing.
Thankfully, there are some treatments for cerebral palsy, including physical, occupational, and speech therapy, as well as various drugs and even surgery.
There are some different types of cerebral palsy, and spastic CP, which causes paralysis, is the most common.
And finally, we concluded by discussing some of the causes of cerebral palsy, primarily genetics, but also blunt force trauma to the head, and even infections before and after pregnancy.
As always, here are the sources we used in this presentation. Feel free to check out any of these links if you want to learn more about cerebral palsy. And here are the image credits as well.
We also wanted to say a special thank you to all of you. Thank you for continuing to support our channel. We really do try our best to manage life, and this channel and your viewership helps us to continue doing what we love. Shaker is going to start med school this year, and I'm going to be a senior in high school, and we really are excited to bring you fresh content to this channel.
Well, that's all for today. Until next time, I'm Shaker.
And I'm Sukesh, and this is Medicine Made Simple. Thanks for tuning into our video, and remember, live happy,
Happy
and healthy.
and healthy.